If you want to learn all about minerals for type 2 diabetes, you've come to the right video because here's what you can expect to learn. First, we'll talk about which minerals are needed to improve type 2 diabetes, which contrast to the minerals for general health. As well, we'll discuss 3 specific minerals that are often claimed to improve type 2 diabetes, and we'll answer the question of do they really? 2 do, and 1 we just don't know. Stay tuned to learn which mineral we don't really know much about. So before we jump in, who am I? My name is Igor. I've been a personal trainer since 2006 with a specialty in type 2 diabetics. As well, I've been presenting at personal training conferences since 2013, training other personal trainers in my methodology, and I've delivered over 400 wellness presentations to some of Canada's largest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. Also, I'm the author of the Amazon best-selling book called Type 2 Diabetes Reversal Secrets. For you, as a viewer of this video, I'm giving away the first chapter of that book for free. That chapter is titled 11 Diabetes Myths That Are Harming Your Health. And the link to that is in the description below, so check that out. As well, if you want to learn when I publish more videos about exercise, nutrition, and supplements for type 2 diabetes, click like and subscribe to my YouTube channel. So now let's discuss which minerals are needed for diabetes versus general health. For general health, there's a lot of different minerals we need: magnesium, chromium, copper, zinc, iron, potassium, and others. For diabetes, there are 3 minerals that we'll discuss specifically in this video. The first one is potassium. Does potassium improve blood sugar control in type 2 diabetics? Let's look at some research that answers that question. This study is titled Dietary Potassium Intake and Risk of Diabetes. Well, what this study does is it shows correlations between dietary potassium and diabetes risk. However, correlation is not causation. Here's an example. I recorded a video titled Vitamin D for type 2 diabetes, and what that shows is that there is a correlation between low vitamin D levels and type 2 diabetes. But does that mean that low vitamin D levels cause diabetes? And the answer to that is no. How do we know this? Well, if low vitamin D levels cause diabetes, then improving vitamin D status should improve diabetes as well. Very logical. However, in research where type 2 diabetics are given vitamin D supplements, their diabetes doesn't improve, which means that we went after the wrong factor. There's probably a third factor that's causing both diabetes and low vitamin D levels, and that factor was not identified in research on correlation. If you want to dive way deeper into vitamin D for type 2 diabetics, click on the link on your screen right now or in the description below. Now, furthermore, there's no research on either supplementing with or eating more potassium-containing foods for diabetics. Does it improve blood sugar levels? Does it worsen blood sugar levels? The answer ultimately, as it stands right now, we don't know. Now, having said that, if someone's dietary intake of potassium is low, it's good to increase potassium regardless of what it does to your blood sugar levels. What are the best sources? I'll bet you're thinking bananas. Bananas are a good source, but not the best source. Here are indeed the best sources: dates, dried apricots, potatoes, sun-dried tomatoes, avocados, and others. And yes, bananas don't quite make the list, but they're good. They're just not the best. Now let's talk about magnesium. Here is a study titled Effects of Magnesium Supplementation on Insulin Sensitivity and Glucose Control. Here's what the study results showed: that magnesium supplementation reduces HbA1c by only 0.018% more than placebo. That's a very negligible amount. But here's the thing about meta-analyses and systematic reviews. They take all the studies and aggregate all the data. And so some studies show no results, some studies show positive results, and you get an average, which is good from a data perspective, but then it blurs a lot of the nuances. So let's look into it. This is what's called subgroup analyses. When people were divided based on their characteristics, they saw different groups of different people have different drops. For example, people who took magnesium for longer than 4 months, actually their blood sugar levels, their A1C, dropped by 0.71%. People with low blood levels of magnesium had a drop in their A1C of 0.14%. And again, this is whether they took it for 4 months or not. in the second case. Now, the question is, should you take magnesium if you're a type 2 diabetic? The answer is, if your magnesium levels are low, then yes, definitely take it. How do you know if your magnesium levels are low? You run a test called simply RBC magnesium. RBC stands for red blood cells. And again, if your blood levels of magnesium are low, take it. However, if your blood levels of magnesium aren't low, don't take it. The greatest benefit from supplementation, not just magnesium, but every mineral, comes from going from deficient to sufficient. You get no more benefit from going from sufficient to excessive. So again, don't take it if your blood levels aren't low. How does magnesium work? Well, one is it can improve your insulin sensitivity. What does that mean? It means that you require less insulin to bring your blood sugar down. If one person needs 20 units of insulin to get their blood sugar down to 5.0, and another one needs 10 units of insulin to bring their blood sugar to 5.0, they both have the same blood sugar level, but the one that required less insulin is the one that's said to be more insulin sensitive. The other thing that magnesium does is it helps you with glucose metabolism. That is the breakdown of sugar molecules. A third way in which magnesium helps blood sugar levels is that it's anti-inflammatory. And the fourth way is that it improves the function of the beta cells of the pancreas, which are the insulin-producing cells within the pancreas. What about food? What are the richest food sources of magnesium? Well, here's some good news. Dark chocolate, Brazil nuts, and pumpkin seeds, as well as almonds, are some of the best sources of magnesium. What about chromium? Here is one systematic review titled Efficacy and Safety of Chromium Supplementation in Diabetes. Here were the results. Chromium supplementation lowered HbA1c levels 0.55% more than placebo. So overall, it's actually a moderate reduction. But again, in systematic reviews and meta-analyses, we get all the results, including ones that weren't effective. What about when we just segment people based on different characteristics? Then we get a different picture. When we do that, we'll see that people who had A1Cs above 8% actually had larger drops in their A1C. Makes sense because there is more to drop. Those who had an A1C below 8% only had a drop of 0.3%. So the greatest benefit from chromium comes when your A1C levels are above 8%. Furthermore, the safety profile is excellent. Chromium had no more side effects compared to placebo. Here's another study titled Effect of Chromium on Glucose and Lipid Profiles in Patients with Type 2 Diabetes. Here were the results. What they found is that chromium reduced blood sugar levels by 0.33% more than placebo. However, again, let's look at it a bit deeper. What happens when you segment it based on certain characteristics? Here is what happens. A1C drops by 0.71% in another group of people. Now, when looking deeper, we see that in studies that last more than 12 weeks, the A1C drops are much more significant, 1.7%. That's a lot, okay? Furthermore, in those taking more than 200 micrograms, the drops in A1C are 1.88%, which means that if your A1C is 8% and you're taking more than 200 micrograms of chromium for 4 months or more, you could drop from 8 to 6.2. This is very, very powerful considering no other changes in nutrition or exercise. Pretty good. In those taking less than 200 micrograms, but 4 months or longer, their A1C drops by 1.13%. Still not bad. How does it work? How does chromium lower blood sugar levels? One thing that it does is it improves the transport of a molecule called GLUT4. GLUT4 stands for glucose transporter. That's not your butt muscle. It's just GLUT without the E. Glucose transporters are enzymes that go from the inside of the cell to the surface of the cell to let glucose from the blood and inside the cell. That's one mechanism. Another mechanism by which chromium helps is that it improves the translocation of these GLUT4 transporters. And lastly, it improves the action of insulin. It makes you more insulin sensitive. And these are the mechanisms by which chromium improves blood sugar levels. If you want to learn about 4 other supplements that can lower your HbA1c by 1% or more, I've created an entire video with that topic exactly. If you want to dive into that, click on the link on your screen right now or in the description below.